The findings from CATCH, I believe, on each site are implemented as we learn the data. You go, I could be better. There's site-to-site variation that we've looked at. So sites that weren't as effective as early front-end loading the patient with optimal therapy had to make more changes to get their patients well. So from that, we learned. It was practice variation, and we learned. When we look at how do the findings from CATCH and research optimize care for other patients, we have publications. We have more than 34 publications. We've had multiple poster and oral podium presentations at very large meetings. And some of those findings help physicians, clinicians to help their patients with RA. As if, for instance, habits can affect remission. So some of these habits are tough to change and some are easier to change. We can try to improve adherence. If you don't take drugs, they don't work at the beginning. Later, you might get drug-free remission or lower amounts of meds, but people need to be adherent. In other words, following the treatment plan is a better prognosis or a better outcome for the patients, but also some lifestyle areas we might be able to counsel on, as can our colleagues, such as if you could lose weight, stop smoking, you have a higher chance of going into remission and doing better and feeling better. For CATCH patients that are contributing their data and maybe serum and getting x-rays done, we can understand more about early rheumatoid arthritis even from their very first visit. And we can also understand a lot if they're doing great for years and we don't want them to drop out, or if they're not doing great and struggling. So the time to remission, the trajectory of response, we can understand quite early how you might do at 5 years, but it's only a prediction. So we can use data from our patients who are volunteering with their blood, sweat, and tears, giving us serum, giving us questionnaires, and having their x-rays done and other things. We can understand more, and more is better because we've seen time trends. As if, for instance, we get more patients in remission the last 5 years than the first 5 years of CATCH, and we have almost 15 years. We have 13 years now of long-term data. I think what's really important in research is that we're trying to find out to treat patients better, and people feel part of something when you're a patient and you're trying to cope with a new diagnosis, and it's so important to be part of that because it's made me a better doctor. And we have research from bench to bedside. Some of the x-rays are being examined, some of the blood tests, sometimes serum is frozen for other biomarkers. We are looking at patient-reported outcomes, and our cohort, CATCH, is one of the largest on patient-reported outcomes. So we validated what a flare means to a patient. We've looked at the discordance between how the physician thinks they're doing or the coordinator and how the patient's doing. So we have really looked at all aspects of RA, how it affects their family, their life, their livelihood, work disability. So it's just so important because there's something for everyone to learn from in this cohort.